As the COVID-19 pandemic rages on, so much focus is placed on two groups, those who get sick and die, and those who get sick and recover. But what about the other people? The people who contracted COVID-19 and aren't getting better?
I don't want anybody to go through what I've gone through. It's been the worst experience of my life.
Jennifer English lives in Oregon City.
Is this cough related to your symptoms you're still experiencing?
Yeah.
Kari Rodriguez lives in Pendleton. Both women were healthy and active, and then they got sick.
I never thought in a million years that I would be laying in this bed for 7 months, with in a shell of myself.
The CDC says about 65% of people who contract COVID-19 recover within 2 to 3 weeks. But for the other 35%, the symptoms are dragging on for weeks or even months longer.
It's unbelievable what I'm going through at 35 years old, previously a healthy person. I didn't even take vitamins before. I was healthy. I didn't think, I was still at the prime of my life.
Both Jennifer and Kari have been experiencing symptoms for months, some of which include GI issues, hair loss, dizziness, nausea, headaches, brain fog, and nerve pain. Kari says she's developed high blood pressure, and Jennifer says she feels like she has dementia and forgets things easily. Jennifer contracted the virus in April, and Kari in July. Since then, their lives have been miserable. They're experiencing what scientists refer to as post-COVID-19 syndrome. The women are asking their doctors for answers, but since this virus is so new, healthcare providers haven't solved all of its mysteries yet, including why some people develop such long-lasting symptoms. Unfortunately, for so-called long haulers like Jennifer and Kari, doctors might not know much about post-COVID-19 syndrome until after there's a vaccine widely available.
By distributing the vaccine effectively, we can decrease the spread of the virus. That decreases the stress on the system, decreases the number of patients who are getting infected. It allows to decrease more cases coming in and overwhelming the system again.
Jennifer and Kari keep hoping OHSU will develop some sort of long haulers clinic to help treat their symptoms. So far, there's no word of that happening. The nearest post-COVID-19 clinic is at UC Davis Health, and both women say they're considering traveling to Sacramento just to receive better care and to help participate in research. Jennifer and Kari haven't met in person, but a mutual friend put them in touch with one another.
It's just all virtual at this point, but I can't wait to meet her and give her a big ol' hug.
Now they contact each other almost daily, sending messages of support. The two women are also part of a growing online support group for COVID-19 survivors. It's called Survivor Corps. Together, along with more than 120,000 support group members, they're hoping they can help find answers and help other COVID-19 patients in the future. They say no one should have to experience what they've endured.